health insurance.
All right, we want to talk about a couple of polls that are out today, ABC, Washington Post polls. First of all, overall looking at the health care law, do you support or oppose the federal law that's making the changes to the health care system? 44% say they support, 48%, still the majority there, oppose. And when specifically asked, do you approve or disapprove of the way President Obama is handling implementation of the new health care law, a much bigger split there, 57% disapprove, 37% approve. Dana, Democrats from the White House on down keep saying the more the health care law rolls out, the better people are going to like it, but the numbers aren't going in that direction yet.
They've been saying that since 2009, and we're almost in the middle of 2014, so that's yet to materialize. It's very durably unpopular. I also think that the Democrat optimism of the past couple of weeks it's now proven to have been unwarranted. The poll from like last month where they said healthcare, oh, people are kind of like getting more accustomed to it, they're more favorable towards it. That was an outlier poll, and they shouldn't have taken comfort in it, but they did, and now they're stuck out on a limb once again. On the president's disapproval number, I think that Americans can't quite put their finger on what it is that they hate so much about the law, the healthcare law itself, but it's also the other things, the Benghazi, the IRS, just the constant tone of condescension. But healthcare is what they can peg their disagreement to the president on.
And to the point of costs on the healthcare law, we have polling on that as well. Do you think the overall costs of healthcare in this country are increasing as a result of changes to the healthcare system, or decreasing, or remaining about the same? 58%. The strong majority there said increase. Only 11% said decrease. 27% said about the same. But Charles, so many of the proponents of the law sold it saying it's about bringing down health care costs.
Right, and that was a phony. That was from the beginning. I mean, a child could have said, here's a president proposing to increase coverage by 40 million Americans, and then saying we're going to do this without the government spending an extra dime. That's impossible. That's a free lunch. He sold it. He got away with it. It wasn't anywhere near true. And, of course, insurance premiums are going up. Chuck is right that there's always a trade-off between cost and access. But the administration made it worse because it imposed coverage mandates. There are 10 areas that every plan has to have, or, as we saw, your plan is canceled as inadequate, right? So all of this stuff is included, some of which you and I don't need, but we have to pay for. I mean, I don't know about you, but I don't need lactation services.
Really?
I mean, I did 60 years ago, and I'm sure I enjoyed them, but I don't need them now. But it's in, if you're purchasing Obamacare plans, it's in there. So that inflates the cost of the premium to start with. So then insurers, in trying to keep from insolvency, have to save the money, and they do it by reducing the network, which is a form of rationing. And that's the beginning of rationing. It's going to get much worse with Obamacare. It always happens when you have universal coverage. Happened in Canada, happens in Britain, happens everywhere. It starts with the reduction in the coverage. You can't have the doctor you want. If you're in northern New Hampshire, you have to drive 2 hours to get to a hospital that will cover you. And that's why the costs are high and the access is low, and that's why the numbers are so bad here.
Quickly, Chuck.